Hey guys, welcome back. Do you want to grow your hairline from this to this? Then this video is for you. First, we'll talk about the common causes of hair loss, and then I'll show you exactly how to grow your hairline back very fast. I'm Dr. Akosh Omali, a licensed medical doctor. Now, let's get right into the video.
So please, at this point, please do not forget to like and subscribe.
Number 1. Genetics. This is one of the most common causes of hair loss, especially in men. If your parents or grandparents experienced baldness or a receding hairline, there's a higher chance you might too. This condition is called androgenetic alopecia, and it's mostly related to hormonal and genetic factors.
So please, at this point, please do not forget to like and subscribe.
Number 2. Stress. When you're constantly stressed, your body releases a hormone called cortisol, which attacks hair follicles and causes them to shrink. This can lead to hair shedding and thinning around your temples or crown. So, reducing stress isn't just good for your mind, it's also good for your hairline. Number 3. Unhealthy diet. Your hair needs essential nutrients like iron, protein, zinc, and vitamin A, vitamin C, vitamin D, and vitamin E to grow strong and healthy. When you don't eat balanced meals, your hair follicles weaken, leading to breakage and hair loss. Therefore, nourish your hair from the inside out with healthy foods. Number 4. Tight hairstyles. This is also called traction alopecia. This one is very common, especially among women. When you constantly pull your hair back tightly in braids, ponytails, or cornrows, it puts stress on the hair roots and causes them to fall out. Over time, this can permanently damage your hairline. So, avoid tight hairstyles that pull too hard on your scalp. Number 5. Autoimmune diseases. Certain conditions like alopecia areata cause your immune system to mistakenly attack your hair follicles. This can lead to patchy or total hair loss on the scalp and other parts of the body. If you notice sudden bald patches, please see a doctor for proper diagnosis. Number 6. Chemotherapy. Cancer treatments like chemotherapy affect all rapidly dividing cells, including those in your hair follicles. That's why most patients lose their hair temporarily during treatment. The good news is, once chemotherapy stops, your hair often grows back. Number 7. Using harsh chemicals on the hair. Frequent use of hair relaxers, dyes, or bleaching agents can damage the scalp and weaken your hair roots. These chemicals strip away natural oils and irritate the follicles, leading to breakage and thinning along the hairline. So, always be gentle with your hair and use mild, natural products whenever possible. Now let's talk about how to grow your hairline back very fast. Number 1. Use Minoxidil Rogaine. Minoxidil is one of the most effective medications for promoting hair growth. It increases blood flow to the scalp and stimulates dormant hair follicles. However, you need to use it carefully, as it can lower your blood pressure in some people. Always consult your doctor before starting Minoxidil. Number 2. Avoid tight hairstyles. Give your scalp time to breathe. If you constantly wear tight braids or ponytails, your hairline will keep receding. Instead, go for looser, protective styles that reduce tension on your roots. Number 3. Consider a hair transplant. If your hairline loss is advanced, a hair transplant might be an option. This procedure involves moving healthy hair follicles from one part of your scalp to the affected area. It's safe and effective when done by a qualified professional. Number 4. Manage stress. Stress management is key for both your health and your hair. Try relaxation techniques like deep breathing, meditation, regular exercise, and enough sleep. When you keep your stress hormones under control, your hair growth improves naturally. So those are the main causes of hair loss and proven ways to regrow your hairline fast. Remember, consistency is key. Hair growth takes time, so be patient and take care of your scalp daily. If you learned something new today, please like, share, and subscribe so you don't miss more helpful videos like this. I'm Dr. Akosh Omali, and I'll see you in the next one.